Hi, I'm Autumn Sanderson, and this is video 2 of my gold standards for COPD exacerbations presentation for respiratory 2480. And this is video 2, supporting prevention. In this video, we are going to cover the key points regarding prevention and maintenance for COPD patients. Preventing COPD. So there are many ways to prevent COPD, but it is absolutely preventable. So we are going to make sure that the patient quits smoking or they don't smoke at all. If they do need help smoking, there are plenty of smoking cessation options, such as smoking cessation programs. Your doctor can even refer you to one of these programs. There are several nicotine replacement options, including nicotine patches, nicotine gum, and there are also over the counter and prescribed medications that patients can take to help curb the urge to smoke a cigarette. You also want to avoid secondhand smoke and other harmful lung irritants. So, in our last video, we talked a lot about how our environment can heavily impact whether or not we have a COPD diagnosis. Um, and really, our environment is going to impact so much more than just a COPD diagnosis. It's going to impact a lot of our lung health. So it's really important that we want to stay away from harmful smoke, harmful fuels and fumes, and all the stuff like that. And then just kind of going back and touching on smoking. I know we talked a lot about tobacco usage and how that is one of the primary reasons why we see COPD diagnosis. But now that we're moving into a newer age where e-cigarettes and vaping is becoming a lot more common, we also have to take that into consideration as well. And not only is the nicotine from that harming our lungs, but also those chemicals can harm them as well. And so when it comes to secondhand smoke, there's not enough research yet out there to tell us whether or not e-cigarettes or vapes can cause secondhand smoke. However, it's better to stay on the side of caution and try to avoid being around that altogether. Also, when preventing COPD, we want to live an overall healthy lifestyle. So that's going to include staying physically active and eating a healthy diet. If we are couch potatoes and eating McDonald's every day of the week, that's not going to be good for our overall health, which is then going to impact our lung health. And also, we want to attend regular checkups with a physician, as we all should. But this is going to be really important, especially as you age. We talked about how COPD patients are sometimes older patients, especially because older patients, their lung function isn't as well as they age. But a lot of our COPD patients are of the older population. And it's going to be really important that you're seeing your physician, you're getting those annual checkups so that they can monitor your overall health as well as your lung health to make sure that nothing's going on that you as a patient might not notice. So we talked about a couple different prevention options, especially if you are somebody who is already a smoker and you're trying to quit. So some options here that I have listed are a nicotine patch. You just wear it on your body and it is a stop smoking aid. We also have Nicorette gum. You chew the gum. I've even talked to some patients who say they just like the act of holding something and putting it up to their mouth. So sometimes even just having a trendy cup with a straw might even help curb the urge to want to smoke a cigarette. And then I also touched on how there are medications, some over the counter, some prescribed by doctors that can also help with smoking cessation. And one of those that I found to be really interesting is actually a medication called bupropion, also known as Wellbutrin. And this is a medication that is also used to treat anxiety and depression, but is also used as a smoking cessation medication. When it comes to controlling COPD and exacerbations, there are several different steps that we want to take, and that's going to include medications, which I'm going to cover more in depth in our next video and touch on in the next slide. But other than that, education is so important. So we want to make sure that our patient is using proper inhaler and spacer usage, especially if they are using a spacer. O2 therapy. A lot of patients do need a little bit of oxygen because their SpO2 is usually a little bit lower. Sometimes patients have SpO2s reading as low as 86 and they have COPD, and that's just kind of where they live. But we want to give them just a little bit to kind of boost that SpO2. Bronchopulmonary hygiene is going to be super important as well, because our patients with COPD have a lot of secretions, and especially our older patients, they have a hard time coughing those up on their own. So there are several different bronchopulmonary hygiene methods and tools that we can use with and on patients to help them kind of get those secretions up a little bit better. And that's also going to help prevent various infections that COPD patients are likely to get. If it's really bad, if those secretions are really difficult to get up, a bronchoscopy might be in the cards. Non-invasive ventilation might be helpful for patients, especially if they are chronically hypercapnic. Invasive mechanical ventilation will see more in our COPD patients who are inpatient in the hospital going through respiratory failure. Palliative care is going to be helpful as well with a lot of our COPD patients. Again, regular checkups, just like I said before. Pulmonary rehab, which is another topic that we're going to talk about in a later video. And this is great for COPD patients because they get to experience something in a group setting. So there's the social aspect of it, which is hopefully going to lead to better long-term results. Patients are further educated on how to use their spacers, their MDIs, their bronchopulmonary hygiene tools, and hopefully have an overall better quality of life. They're going to be exercising, moving around more. And in my experience in clinicals with pulmonary rehab, it's a very positive environment. So I think that is a great tool when it comes to controlling COPD and exacerbations. And again, like I said, education is so important. That's why our role as respiratory therapists are so vital for these COPD patients. We see them all the time in the hospitals, going through severe exacerbations, but it's also really important that we are educating them on how they can control their symptoms when they're outside of a hospital environment so we can hopefully reduce those hospital visits in the future. Some COPD medications are going to include our short-acting bronchodilators. Those are our SABAs and our SAMAs. We've got our long-acting bronchodilators, our LABAs and our LAMAs, inhaled corticosteroids, and then if you need them, a leukotriene modifier, expectorants, and antibiotics if they have an infection. We're going to see this more so in a hospital setting. In this image, I have a couple different examples of bronchopulmonary hygiene. The gentleman up on the top left is holding a flutter valve. The gentleman to the right of him is an example of pursed lip breathing. And this is really great. Patients can use this without any device. They can do this on their own. They don't need to be prompted. And it's a great way to help move those secretions up. And then at the bottom, we see vest therapy. Sometimes we see this in the hospitals. Sometimes it's just done on the bed if the bed at the hospital has the option to do CPT. But we also see this in pulmonary rehab. I know a lot of pulmonary rehab patients really like the chest vibration. It helps kind of break everything up and get those secretions moving up quicker. And I'm just now realizing that all those guys kind of look alike. I don't think they're the same person. Goals of COPD maintenance. So, like I said before, it's chronic, it's not reversible, but with the right treatment plan, not everybody is going to have the same treatment plan. But with the right treatment plan and a strong support system, this could be your family, this could be your healthcare providers, this could be the people that you meet in pulmonary rehab. Patients have the option to live a long and successful life. So, our goal is to reduce and limit the number of exacerbations and hospital stays and symptoms in our stable COPD patients. And for our COPD patients who are in the hospital, our goal is to get them to better health quickly so that they can be discharged and then placed on a maintenance plan that works for them. And like I said before, not every maintenance plan fits all. You really need to have a COPD maintenance plan for your patient based off of their lifestyle, their requirements, and their symptoms. Some COPD patients' symptoms don't even present the same. So we just have to make a good maintenance plan for that patient. And sometimes that takes trial and error, trying a few different medications, trying a few different therapies. But with the right support system and the right healthcare team, it's definitely possible. And so, in summary, we talked about the prevention of COPD, heavily touching on smoking cessation and a healthy lifestyle. We talked about the maintenance of COPD if you have it, what your treatment plan looks like, and heavily touching on medications, bronchopulmonary hygiene, and pulmonary rehab. And then we quickly touched on our goals, and that overall is to limit the number of exacerbations and hospital visits while also reducing symptoms in our COPD patients. And these are my citations for video 2.